Assalamu alaikum wa rahmatullahi wa barakatuh. I had them mention that I'm a psychiatrist. Yes, that's very true. That's what I do. I've at various times been a lecturer. I lecture psychiatry at some point. Right now I practice. Okay, so when it comes to psychiatry, you can rest assured that whatever I tell you is what we know currently. Alhamdulillah, for this program, I think there is no better time really in which to bring the knowledge of mental health to the ulama. You know, there is no best, like I said, this time is quite apt, given the fact that the issue of mental health, there are various aspects of mental health, but it's occupying the front burner today. And the more informed that we are, the better we will be equipped to take the right decisions in order to have optimal mental health. Now, I'll take about 30 seconds to really apologize. I didn't plan to be late. I've been told, more than 2 or 3 weeks ago, so I was fully aware of this event. As at yesterday, we were still talking. So I knew this morning, they still sent a message, I replied. So I think that just about midday, I got a call from the hospital. My assistant happens to be a Christian. He was in church. So it's something that it's mental health, it's psychiatry. So I needed to attend to it. I went there hoping to spend 1 hour so that I would leave by 1 p.m. and be here by 1:30. But, well, I think the rest is history. So I really appreciate the fact that you have been patient enough. May Almighty Allah reward you all abundantly for that. So let me get to the crux of the matter. The topic before me is Islamic medical and psychological prescriptions, how to manage depression and anxiety. Well, I think before we can understand how to manage a condition, it's important that we first understand what those conditions are really, okay? Many people will have come across patients or individuals who say they are depressed. I'm depressed also. But then, being depressed, what does it mean to be clinically depressed? That is actually the crux of the matter. Because when we talk of a disorder in mental health, for example, it is actually an expression of normal emotions, normal behavior, in an exaggerated manner. Let me put it that way. So, for example, we all laugh, isn't it? If you see something that amuses you, you would laugh. But then, if you see someone that is just laughing without anything to have stimulated that laughter, you start wondering, is everything all right here? Okay? So, the line between normalcy and a disorder is just in terms of the extent to which whoever it is expressing that particular behavior. If I lose my car, for example, I've parked out there, if I get there and I don't see the car out there, the normal emotion is for me to be unhappy that, oh, my car has gone. If in 3 days' time I'm still unhappy about that, people might understand that, okay, well, yes, he lost his car 3 days ago, so, and perhaps it's my only car, so, it's difficult for me to adjust to that. So if I'm depressed, first day, second day, third day, yes, people will still excuse me. In 6 months' time, I am still crying and wailing that my car is stolen. People will like, okay, there's a problem here. Now, I'm just trying to paint a scenario whereby we understand that normal emotions, what delineates normal expression of emotions or behavior is usually in the extent or the duration in which it's happening. Okay? So, what is the depression? Let's start with that. Okay, I didn't really edit this. So, what is depression? Depression is a mood disorder. Okay, it's a clinical condition that is characterized by 3 main things. There is low mood, there is low energy, and there is loss of interest in previously pleasurable activities. You see, when you are unhappy, if you lose something, or if someone gets you angry, you may be unhappy. That's understandable, and that's absolutely normal. If one is bereaved, a parent dies, a relation dies, you will feel, we are all humans. So the tendency is that you will be unhappy. You can even cry. It's allowed. You can mourn that person. Okay? But then it's expected that as time goes on, you should collect yourself together and live, give thanks to Allah and start living your life normally again. It doesn't mean that you didn't lose anyone. No, you did. But then you have to forge ahead with life, as it were. Now, in depression, clinical depression can actually happen to an individual in the absence of anything. You don't have to lose something. You don't have to be bereaved, for someone to become depressed. Some will even tell you that depression is a disorder of maybe, when you are broke, for example, you don't have money on you. You are likely to just be a little bit quiet. You don't want to cause trouble because you know that you may not be able to deal with the repercussions. That doesn't make you depressed, But then, we have had instances where someone that has got all the benefits of life, as you know it, riches, houses and all of that, and they still become depressed. For the layman on the street, be wondering that with all what Allah has blessed this individual, why is he depressed? So we need to understand that depression goes beyond just feeling unhappy. It is actually a clinical condition, all right, that when the diagnostic criteria has been met, needs to be treated medically. There is role for psychological treatment. And of course, there is the role, we will consider the role of Islam or the Muslim belief system as part of psychotherapy. It's actually, there are scientific works that has been done in recent times that has shown that, for example, reciting relevant surahs in the Quran can actually help manage depression. But then there is a level of severity that the depression comes with that ordinary recitation may not be the appropriate thing. Mild, yes. Moderate, yes. Severe depression, it will help, definitely. But then you need to take medical intervention to rapidly get a response. All right? So depression is a mood disorder characterized by low mood, feelings of sadness, and low energy. Those are the three core things you find in depression. There are several other things that you find in depression also. However, all those other appendages that you find can be tied to these three core symptoms that you find in depression. Okay? So it's deeper than normal experiences of unhappiness, sadness that comes with loss of valuable person or relationship. And it lasts longer than expected for whatever situation that may have precipitated it. Then it can occur out of the blue, just like I told you. You could have everything and the person becomes depressed. So why is it happening that way? Okay? So you find that the people start thinking that, no, look, snap out of it. You're more than this. You should be able to control your emotions. No, it is not a failure of character. If the person can, he definitely would not want to be in that depressed mood, because that depressed state of mind is a very deep, dark place for any individual to be in. Next slide, please. So these are the three core symptoms again, like I mentioned earlier. Go back. There is something highlighted there. Essentially, everything is low in depression. In a depressed state, everything the individual experiences is low. There is low energy, low mood, Then there is lack of interest, things that used to amuse the person. The depressed person will find it difficult to laugh, no matter how amusing the situation might be. Appetite is low, sleep is bad, or low sleep, if I want to use that characterization. Low energy, loss of interest. The person that used to go to work, loves working, cannot work. Okay. Oh, fantastic. This is good. Yes. There's one other point I was trying to make. Anyways, we'll get there. I'm sure it's part of the slide. Okay, now we can skip. Okay, fine. So I've mentioned a few other symptoms you can find in depression. Low appetite. Paradoxically, in some form of depression, you may have increased appetite too. But usually, someone who is depressed doesn't even have interest in food. That's why you find that for people who have been depressed for a long period of time, they tend to lose weight. They lose weight. Okay? Low libido. Well, this should apply to the married folks amongst us. It's libido, I don't know if the technical term, but I think I can explain it in layman language. It essentially means interest in sexual activities. Okay? Yes, every young person, young lady, normally you have your libidinal instincts. But then in depression, such things will not even interest you. Okay? Poor sleep. All right? Like I mentioned earlier. So the kind of sleep in depression is that you find the person waking up hours before their normal waking time. And no matter how much they sleep, they will never feel refreshed. If you have a good sleep, for example, you sleep from, let's say, like after Isha, or 10 p.m. or 11 p.m., depending on your normal sleeping time, and you wake up by Subh, normally you feel refreshed, you feel energized to start the following day, because sleep normally is a time when the body revitalizes itself. But a depressed person may have slept from Maghrib, skip Isha, and wake up by Subh, and he still finds it difficult to stand. Even if he manages to wake up and every single activity is difficult for them to do. They don't feel refreshed. So no matter how much they sleep, the sleep is not refreshing, it's not invigorating, it's not revitalizing. Okay? So I've mentioned the issue of weight loss. For those that paradoxically have excessive appetite, they may actually gain weight when they are depressed, because there is this craving for sweet things, sugar or carbohydrate or type of meals. So people who are depressed, a few of them may actually gain weight instead of losing weight. But the classical thing you find is that a lot of them lose weight. Okay? Reduced level of immunity. Like I mentioned earlier, that everything in depression is low. So if depression persists, the tendency is that the immune system will also be low. Then the person will be predisposed to coming down with all sorts of other illnesses that the body will have thought of normally. Please, next slide. Okay? Reduced level of social interaction. A depressed person if someone is depressed, he's not likely to come to this gathering. Because even though he may appreciate to some extent that, well, yes, it's a religious gathering, I'm likely to gain, but the energy to go is not even there. So you just tell, please, I go. I will stay home. Then it may even be that the person will completely lose interest in even coming. The salat will become a lot of work for them. Not that they don't know that it's important for them to pray, but they cannot. The energy to pray is not there. Then again, depending on how deep the depression is, they can even completely lose interest in praying. Because as this depression gets more severe, they start having other interesting feelings of guilt, feeling of weight, of not being useful. In fact, they will be wishing themselves terrible things that one should not even mention. So poor work academic output. A depressed person is not likely to give the utmost, the optimum at the workplace. So you find that some person may lose their job and the reason you'll be told is that he's incapable. He's not giving out enough. Enough. He's being paid for work not done. It's not as if he doesn't have the skills, but when he's depressed, he doesn't have the interest in the work. He doesn't have the energy to do the work. So the output is going to be poor. All right. Then again, similarly, you can find out that somebody that used to be very sound academically, all of a sudden, it just drops. He's not interested in going to classes. He goes to classes, he can't even retain what is being taught. In a depressed mood, that is the kind of scenario that's going to play out. So the person that's getting straight A's starts getting F's, D's, carryovers here and there. You start wondering what is happening. Of course, it's not only depression that can lead to this. There's a more severe mental illness, schizophrenia, that can also do this. Okay? Poor self-care. A depressed person doesn't find any reason to take care of themselves. They don't groom themselves. They will not wash their clothes. They will not change their clothes. They are not interested. Even if they know that they are, I look dirty, but the energy to even go and wash is not there. So poor self-care, apart from social isolation, poor self-care is another thing that you find in depression. Feelings of poor self-worth. The person feels that I'm not worthy of anything. In fact, the reason for not coming to the masjid might actually be that he feels like I'm not even worthy enough to enter to go to the masjid. So why should I carry me, a sinner like myself, someone who is filthy like myself? Why should I come and desecrate the mosque or something? No, I'm not going there. That feeling, deep feeling of worthlessness can actually be the reason why the person will not mingle with other persons. They prefer to isolate themselves. Okay? Feelings of guilt. This scenario, guilt feelings, this person starts feeling guilty for every bad thing that's happening around them. Or they may be feeling guilty over things they have done in the past. Like while we are all growing up, there are probably opportunities where we have come across an idle meat in the soup. Nobody's watching, you pick it up and clean your mouth. That was not a problem then, Or maybe you got caught, you got spanked, and alhamdulillah, you are fine. Now it's bad behavior. You don't do it any longer. But 20 years later, the person might now become depressed. I will now be recalling that time that he stole meat from the pot and now be feeling bad about it and feeling guilty about that. How do you correlate that? That is what happens in depression. Guilt feelings. An unfortunate event might happen to somebody close to the individual, and you find that the person will be feeling that I'm the one responsible. It's because I am a bad person. That's why this person had an accident. It's because I'm a bad person. That's why hot water poured on this lady. They will attribute all the negative aspects of what's happening around them to themselves. And that's very common amongst elderly women. You see all those so-called witches that you say I don't know how many of you speak Yoruba here. Nobody speaking Yoruba here? Just one. 2, 3. Why not? Okay. Anyway, it's not just in Yoruba culture. I'm not Yoruba, but I grew up in Lagos, so I know a lot about the culture too. They will tell you that Ajenka, that the witch is confessing. This is likely a depressed old woman. Look at the typical picture of an old man, for example, anywhere at all, maybe typically in the village. She has grown old. Most likely the husband is late. Most likely, for one reason or the other, she may have had a child, depending on how long she lived, that may have died maybe long when she was still giving birth to her kids. Then, in a depressed state, she will now start saying, I'm the one that is responsible for the death of my husband. I'm the one that is responsible for the death of my kids 25 years ago. Those ones that I used, she will erroneously attribute all those unfortunate incidences to herself. Then, of course, the neighbors, what will they think? They will say, this is a witch. Before you know it, tire will come, petrol will come, they will roast the poor woman. But this woman was just sick. A few tablets of the right medication and right counseling, she will come out of it and become very bright, and all those feelings will go. But because of lack of knowledge, ignorance, the tendency is that we just tag such persons as a witch. So many people you find confessing sins, especially old elderly women. Be very careful, especially if there's a mob action. Such people actually need help, not punishment. Most of what they are saying it out of the mental state they are at that point in time, not because they actually did those things. Okay? So poor outlook yes, people that are depressed feel like there is no future. The future is bleak. There's nothing for me to expect going forward. And that is usually what drives people to becoming suicidal. So in severe depression, before you know it, suicide starts becoming a welcome idea. They feel I've suffered and there's no point continuing this suffering. And I mention women a lot because if you look at the epidemiology of depression, it's actually commoner amongst women. It happens to men quite a lot too. Okay, but it's commoner amongst women than in men. Similarly with anxiety, which we are going to talk about shortly too. Okay, so you can find a woman. If you read the paper, if you listen to the news, you find a situation whereby they said somebody, maybe a woman, killed her children and committed suicide. A depressed woman will feel like, okay, there's no point for me living again. Now I have young children. Who is going to take care of them? They are going to suffer when I die. She has already made up her mind to die. So in order to save those children from suffering, after she leaves, she kills them. She can poison them, she can throw them inside a well, and she will kill herself too. She was actually taking that action knowing that, well, she's going to die anyway. She has made her plans to kill herself. But then, these little kids, who's going to take care of them? No, fine. Let me just relieve them of that suffering, and let's all go. That is how the mind of a severely depressed person works. Not that he or she really meant to kill those persons. Next slide. Okay. Negative thoughts include something like, I'm worthless, I'm a failure, I can't achieve anything in life, I'm responsible for other people's ill luck, others will be better off if I'm gone, Then, of course, suicidal thoughts and things like that. Next slide, please. So how depression can manifest? Here I just tried to give some clinical scenario of the grading of depression. We can have mild, moderate, and severe depression. And again, clinically, before we say somebody is depressed, the person must have been in that mood state for 2 weeks. If somebody has been feeling sad for the past 5 days, 8 days, 10 days, and you bring the person to me as a clinician, I will not tell you he's depressed. Okay? However, if that person has been depressed in the past, has met that 2 weeks time in the past, and now comes to the 2-day history of depression now, because of that previous history, I will say, yes, he's depressed now, because I already have an idea that this person has experienced it before and is likely to go along that pathway if it is not managed. Depression, like I said, is something that needs to be managed as early as possible and as fast as possible, because as it progresses, the outcome can be very, very poor. Okay? So there are symptoms we use, two core symptoms. I mentioned those 3 core symptoms now. So for mild depression, you need to have at least 2, and 2 any other of the other ones. In moderate depression, you must have minimum of 3, whereas in severe depression, all the 3 core symptoms will be there, and several others. So we use all those to help us make clinical diagnosis of depression and put grading to them. Okay, that's not what you need to know is the fact that, okay, there are 3 main symptoms and there are several other ones. You can forget about the counting. I've just used them to break it down. All right. So next one, please. In mild depression, it may go unnoticed because it is mild. The person just feels weak. I don't feel like going for lectures today. He wakes up in the morning, go to school, go to Islamia. They don't want to go. Well, it may just go that way. You spank the child. Depression can occur in children too. Yes, we need to know that. In children, it can occur. So, but then many of them, you just start, what's wrong with this lazy child? Most of the time, they end up getting beaten. Because you find out, I've asked you to bring this, get me a bottle of water and say, why is it taking you so long? There's no energy to go and bring it. But you think that the boy is being lazy or something, you spank him. But, well, it's not so common, but it occurs even in children too. Or you find a child that just crying incessantly, just crying. Crying spells is one of the things you find in depression anyway. So the mild ones may actually go unnoticed. That is, they don't get to the attention of a clinician. Most of the time, if it's just mild, you may not need drugs to manage it. Just counseling, encouraging the person might just be what is needed to deal with it. Next one, please. Okay? Moderate depression is a little bit more severe than the mild one. In moderate depression, you have a lot of anxiety symptoms, fear, worry, restlessness. I don't know if there are any traditionalists that used to. I think there should be a Baba Isha van around here that used to talk now. You hear them, they will be talking about something moving in your body, things like that. Those are anxiety symptoms. All those feeling of movement, some will tell you is staphylococcus. Indeed, the person is experiencing movement, but there are physiological or there is a biological reason why those movements are there. It's not as if there is no staphylococcus causing anything. There is no ant moving anywhere. These are symptoms of anxiety. Some people will tell you that every time they will be feeling internal heat, deep internal heat, as if they put the fire near them. You touch their body, it's normal. But they are feeling it. And it's not a lie. They are not just making it up. Indeed, they are feeling it. See? No, are you sure? Okay, fine. Oh, that's true. Let's make it 5. Can I make it 5 minutes? Okay, fine. All right, so please. There are a lot of anxiety symptoms that come with depression too. So in mild depression, it might even be clouded by anxiety symptoms. Next slide. Okay, so severe depression, like I mentioned, has all the cross symptoms, and that's why you start having suicidal and homicidal tendencies, and some are completely inactive. They just remain in their house. They urinate and stool on themselves in the same position. They don't have the energy to even move to go and ease themselves. That's how bad severe depression can be. So who can be affected? Anybody, irrespective of social class, rich, poor, middle class. Depression can come upon you, male or female, yes, but a higher preponderance among females, especially in the extremes of age, okay? Can be direct consequence of advice, yes. A loss event, bereavement, can actually be what will trigger that depression for the first time. Okay, next slide. Okay, why persons develop depression? Okay, like I said, it can just occur. Absolutely, you'll not be able to find a reason why this person is depressed, but he's depressed, okay, just like any other medical condition, all right? So then it runs in families too. It can be inherited. The tendency to develop depression may be inherited. If you have parents that are depressed, there is a possibility that you too, if the environment and circumstances are right, might also develop depression along the way, okay, but it's not a must. Okay, physical illness can do that. Next slide, please. All right. Okay, anxiety. Okay. So I've decided to put it this way. Anxiety is more or less like the twin sister of depression. In fact, clinically, we call them 2 peas in a pod. You know granite now, when you break it, there are usually 2 of their heads. So if you picture it, one of them is depression, the other one is anxiety. So most of the time, by the time you have depression, anxiety symptoms are usually present. So we usually call them 2 peas in a pod. And interestingly, their treatment is almost very, very similar. Because it's the same group of medications that we use in managing them. Okay? I have frequently coincides with depression, characterized mainly by feeling of unease. So all this one is the 4th point. Bodily symptoms, difficulty breathing, shortness of breath. Some people tell you that they feel as if there's something in their throat. They cannot swallow. Or if they swallow, they feel that the food is stuck there. It's different from when you eat fish and the bone is there. That one is different too. You just keep feeling this lump in your throat. You drink water, you take all sorts of things, it's still there. Those are anxiety symptoms. Tremulousness, ill at ease. Your mind is beating, your heart is pounding. Every time you can virtually hear your heart beating. Okay? Abdominal discomfort. Every time, a lot of noise in your tummy. Those are anxiety symptoms. I'm sure if you listen to Baba Aisha's thing, he will tell you all these things too. Those guys have really read, I'm sure they've read our books and they know what to tell you. Anxiety symptoms are common in the society. For example, you've written an exam. You don't know, maybe you didn't read well. And you hear that the result is out. You'll be anxious. Okay? Exactly. But if you go now and you pass, alhamdulillah, alhamdulillah, you are happy. The anxiety should go. But anxiety disorder, you feel anxious in the absence of nothing threatening you. No threat is there, and yet your body is shaking. In some cases, it comes in episodes. That's the one we call panic disorder. You just wake all of a sudden from sleep with panic. Your heart is pounding, you can't breathe, you are sweating, you feel like rushing to the toilet, you feel like you're going to die, and within minutes, it calms down by itself. Then again, it can happen all of a sudden, even when you are awake. So there's that group of anxiety problem that we call panic disorder. Okay? So all these symptoms here, feeling dizzy, unsteady, some people tell you that they feel light when they are talking, they feel as if the wind is blowing them. They're all anxiety symptoms. Okay? So next slide, please. Let me jump. So types of anxiety, I've just tried to mention quite a number of them. Separation anxiety disorder, phobic anxiety, social anxiety, generalized anxiety, panic disorder, obsessive compulsive disorder. It would have been nice if I had a time to elaborate on all of this. But I think I've really run out of time. Adjustment disorder, post-traumatic stress disorder, that's the one they call PTSD. You must have been hearing something like that on the news severally. You find it a lot amongst people that are exposed to trauma. All these kidnapped victims that we have been hearing these days, a lot of them will eventually come down with post-traumatic stress disorder. Being a victim of kidnap with a threat to life, or having been in an accident, or seeing people being killed, or witnessing people dying, violent scenarios, collapse house building and things like that. Those are stressful conditions in any person. But some individuals, when they express it, apart from feeling bad, then they may go on and develop post-traumatic stress disorder, a disorder as a direct result of that event that they have witnessed, which keeps on flashing back into their mind as time goes on. Okay, let's go to the next one. I think this should be the penultimate slide. Okay. In managing depression, we usually follow three main rules: biological, psychological, and social, because we look at the individual holistically. So the religious management is captured under the psychological or psychosocial management. Okay, I didn't elaborate too much on that one because I think I decided that let you understand what depression means first. Our ustads here will be able to remind us of appropriate verses in the Quran that can help when you are moody. We all know that the Surah Duha is one of the very good ones that we know the circumstances under it was revealed when the Prophet Muhammad sallallahu alaihi wasallam lost I think it's his child or something. I can't remember exactly. So we know that there are various verses or surah in the Quran that were revealed for specific scenarios. So it goes beyond just reading those verses. It is actually understanding the content and the context of the revelation of those verses that can make it helpful. However, the research has also shown that just listening to a beautiful recitation from the Holy Quran, whatever verse it is, as long as it is sonorous, it is rhythmic and well recited, it's soothing to the nerves. These are scientific researches that have been published in scientific journals that have shown this fact. So people are actually getting very interested these days that, okay, what is the role of religion, Islamic religion, really, in management of psychological problems? So, next slide, please. Okay, fine. Okay. Right now? So, I think I'll just have to, who is calling the prayer? Is he around? Okay, so I don't know. It's about time to call prayers, so I have to budge. So, assalamu alaikum wa rahmatullahi wa barakatuh.